Hello everybody. Today we will read about uterine artery embolization. Uterine artery embolization was first used by Professor Ravina in 1991 to reduce vascularity of fibroids before surgery. It leads to symptomatic relief and decrease in size of myoma, avoiding surgery. Hence, it is now used as an alternative to surgery. Now, procedure. It is an angiographic interventional procedure in which polyvinyl alcohol particles or other synthetic particulate emboli, that is gel foam particles, are delivered into both uterine arteries, obstructing blood flow in uterine arteries to produce ischemia and necrosis of myoma. The particles are preferentially directed to the fibroid due to the large caliber of their feeding vessels as compared to smaller vessels in normal myometrium. It is an angiographic catheter is put percutaneously in one femoral artery and advanced under fluoroscopic guidance to sequentially catheterize both uterine arteries. Single uterine artery embolization has poor success. Prior to uterine artery embolization, the gynecologist should perform pap smear to rule out cervical premalignant and malignant lesions, cervical swab to rule out chlamydia and gonorrhea, and endometrial sampling to rule out endometrial cancer. Complete blood count, renal function test, that is serum creatinine, bleeding and coagulation tests, prothrombin time and partial thromboplastin time are also performed. A short admission time, that is 1 to 2 days, is needed for post-operative management of pain with non-steroidal anti-inflammatory drugs. Now, efficacy. The procedure caused improvement of menorrhagia in 80% women, in dysmenorrhea in 77%, in urinary frequency in 86%, and reduction of fibroid volume by 33%. Now, advantages of uterine artery embolization. First, no major surgery. It is a minor procedure. Second, no intraoperative bleeding. Third, short hospital stay of 1 to 2 days. Fourth, no risk of abdominal adhesions. Now, disadvantages. It is expensive and not readily available. Only tertiary referral centers have it. Second, complications can occur. Third, it is not recommended in young infertile women. Now, post-operative complications. Post-operative complications are few and are as follows. First, post-embolization syndrome. It is seen in up to 25% cases and lasts for 2 to 7 days. Patient complains of pelvic pain, nausea, low-grade fever, malaise, and mild leukocytosis. It is due to myoma necrosis. Treatment is supportive care, that is rest, intravenous hydration, and counseling, and analgesics. Antibiotics are not needed but can be given if there is suspicion of endomyometritis. It responds to treatment within 2 to 3 days. Second, persistent fever. It is treated by antipyretics. Third, infection. It is treated by antibiotics. Fourth, pain. It is due to ischemia. It can be managed by NSAIDs. Fifth, groin hematoma at sites of femoral artery puncture. Sixth, vaginal discharge and bleeding in up to 5% cases. Seventh, amenorrhea, especially in older women. 8. Ovarian failure due to passage of emboli and ovarian vessels through anastomosis between uterine and ovarian vessels. 9th, non-target embolization of mesenteric vessels leading to mesenteric artery occlusion. 10th, expulsion of myoma through vagina. 11th, failure of procedure. 12th, recurrence of myoma. 13th, reduced fertility. 14th, pedunculated subserous myoma can become infected and cause peritonitis. Pregnancy complications. If woman conceives after uterine artery embolization, there are increased chances of miscarriage, postpartum hemorrhage, and caesarean delivery. Some studies also found increased rate of preterm deliveries, fetal growth restriction, and abnormal placentation in pregnancy after uterine artery embolization. Now, contraindication of uterine artery embolization. Absolute contraindication. First, suspected pregnancy. Second, active pelvic infection. Third, suspected gynecological cancer. Now relative contraindications. First, any bleeding diathesis or coagulopathy. Second, kidney disease, risks of renal impairment from contrast material. Third, large uterine size greater than 20 weeks fibroid. Fourth, infertility, risks of pregnancy complications. Fifth, any allergy to embolus material. Sixth, past history of pelvic radiation, that is radiotherapy. Seventh, past pelvic surgery, chance of arterial course. So, the main indication of uterine artery embolization is medium sized fibroid with heavy menstrual bleeding in multiparous women. Thank you for listening. Thank you.